The onion is one of the most common vegetables on our table, yet at the same time it is a special food that has accompanied the long history of humanity. In the murals of ancient Egypt, workers who built the pyramids are depicted eating onions and garlic, and there are records showing that soldiers and athletes of ancient Greece crushed and drank onion or ate it raw to gain strength and endurance. During the Roman era, soldiers also ate onions before expeditions to maintain vigor, and in medieval Europe the onion was used for medicinal purposes, becoming an essential ingredient in folk remedies. Thus, the onion has been far more than a simple aromatic vegetable. For thousands of years it has supported people's health and daily life. In modern society, however, the onion is treated mostly as a flavoring or side dish, and few people fully understand its true value. Moreover, many consume it in the wrong way, losing the benefits they could obtain and sometimes even harming their health. The reason why the pharmaceutical industry and the medical community do not fully disclose everything known about the onion is simple. If the onion were truly used widely and properly, the consumption of drugs for hypertension, diabetes, and cholesterol would decrease, threatening the structure that generates enormous profits. For this reason, the true power of the onion is not well known, and while it is present in the refrigerators of most households, it is rarely used correctly. To understand the onion's remarkable power, one must first look at its components. The most representative is allicin, a sulfur compound. Allicin is formed when the onion is cut and the cell walls are broken, triggering an enzymatic reaction. It is responsible for the characteristic pungent smell and for the tears that appear when cutting onions. But allicin is not just an irritant, it has the ability to dilate blood vessels, lower blood pressure, and improve circulation. It has also been reported to have antibacterial and anti-cancer effects, which is one reason why onions are considered a health food. However, allicin is highly unstable. If the onion is cooked immediately after cutting, it is destroyed by heat before forming in sufficient quantity. Therefore, after cutting an onion, it should be left to rest in the open air for at least 10 to 15 minutes so the enzymatic reaction can complete and the effect of allicin can be maximized. A research team at Kobe Medical University in Japan compared onions cooked immediately after cutting with onions left to rest before cooking and reported significant differences in the reduction of blood pressure. Another key component is quercetin. Quercetin is a flavonoid antioxidant that helps protect cells from damage, reduce inflammation, and strengthen the immune system. It is especially concentrated in the onion skin, but most people discard it when peeling onions for cooking. In reality, the most valuable part is being thrown away. Researchers from the College of Pharmacy at Seoul National University reported that the concentration of quercetin in the onion skin is several times higher than in the edible flesh, and confirmed that this substance can help prevent cancer, reduce heart disease, and protect blood vessels. Therefore, it is advisable to wash the skin thoroughly, dry it, grind it into powder, and add it to meals as a condiment, or boil it to make a tea. There are several golden rules for consuming onions properly. The first is to wait after cutting. During this resting time, the enzymatic reaction proceeds, sufficient allicin is formed, and its blood pressure regulating and antioxidant effects are maximized. The second is to make use of the skin. Throwing away the skin is equivalent to losing a true treasure of quercetin. If dried and powdered, it can be easily added to rice or soup, and its regular intake contributes to the prevention of cardiovascular disease. The third is the cooking method. If onions are boiled for a long time in water, water-soluble nutrients are lost into the liquid, but if they are lightly sautéed in oil, whether sesame oil or olive oil, the absorption of fat-soluble compounds improves and the bioavailability of quercetin increases. A Japanese research group reported that when onions were cooked with sesame oil, quercetin absorption increased more than fivefold. The effect of the onion also depends on the time of day it is consumed. Several clinical studies have shown that eating it 30 minutes before lunch provides the greatest benefit in controlling blood sugar and improves insulin sensitivity. Conversely, consuming it on an empty stomach in the morning or after 9 o'clock at night can irritate the gastric mucosa, worsen gastritis or acid reflux, and cause insomnia due to increased gastric acid secretion. Therefore, the best time to consume onions is before lunch. Doing so before dinner can also be beneficial, but it should always be finished at least 3 hours before bedtime. The effectiveness of onions also varies according to their color. Purple onions contain abundant anthocyanins, pigments with powerful antioxidant and anti-cancer properties, especially useful for preventing stomach and colon cancer. Yellow onions are the richest in quercetin, making them highly effective in reducing blood pressure and cholesterol levels and in maintaining vascular health. White onions contain relatively more allicin, which aids in controlling blood sugar and improving insulin sensitivity. Consequently, those seeking cancer prevention should choose purple onions, those needing cardiovascular management should opt for yellow onions, and those requiring diabetes control will find white onions more appropriate. However, onions are not unconditionally good for everyone. People taking anticoagulants to thin their blood may face a higher risk of bleeding when consuming excessive amounts of onion. Patients with kidney disease should be cautious, as the potassium in onions can cause dangerous hyperkalemia. Individuals with hyperthyroidism should also be careful. Likewise, people with gastritis or stomach ulcers may see their symptoms worsen if they eat onions on an empty stomach, and those preparing for surgery should avoid them at least 2 weeks beforehand. In the end, onions must be treated like medicine. Only in the correct amount and form do they provide benefits, and their consumption must be adapted to each person's health condition and constitution. Practical ways to make use of onions include several methods. One is onion skin powder. Wash the skin thoroughly, remove impurities, dry it completely in the shade, and grind it into a fine powder. This powder can be added in small amounts to meals to ensure a steady intake of quercetin. Another option is sesame oil sautéed onions. Slice them thinly and horizontally, let them rest for 15 minutes, and then cook them slowly in oil until golden brown. In this way, the absorption of quercetin in the body increases significantly. A third option is onion tea. Slice a whole onion with skin thinly, boil it together with a piece of ginger in a liter of water, and add a little honey before drinking 2 cups a day. This preparation can improve blood circulation and help warm the body, proving useful even in people with angina symptoms. It is also important to consider how onions should be stored. The ideal way is to keep them in a cool and dry place, because if they are placed in the refrigerator, they tend to spoil more quickly due to moisture. However, once cut, they should be kept in an airtight container in the refrigerator and consumed within 2 days. In addition, it is advisable to store them separately from other vegetables to slow down the process of deterioration. In this way, although the onion is a common and easily accessible vegetable, it can become a true ally of health if consumed correctly. It can help regulate blood pressure and blood sugar, protect the health of the heart and blood vessels, and prevent cellular damage thanks to its antioxidant action. But if consumed incorrectly or without considering personal health conditions, it can even cause harm. The onion goes beyond being a simple culinary ingredient and, with the right knowledge and use, can become a powerful tool to protect our health. Therefore, we must incorporate into our daily lives the golden rules, allowing the onion to rest after cutting, making use of the skin, and respecting the most suitable times of day and cooking methods. At the same time, those taking medication or suffering from specific illnesses should always consult a professional before modifying their diet, to ensure that onion consumption is appropriate for their condition. The onion has accompanied humanity throughout history and continues to be present in our kitchens. But the way we treat it can make a great difference in our health and quality of life. With the right knowledge and practice, the onion can undoubtedly become a true golden law for saving lives.